Good morning, sisters. How are you? How is your baby doing? This is the first complete examination of a newborn before sending to the mother. Good. Thank you. Now, before examining the baby, just observe about the color, activity, cry, any noisy sounds, and before baby cries, you start auscultating the heart, about the abnormal sounds of the heart, heartbeat and rate, and just check both side of the chest about the lungs and the air entry. Then you start examining the baby. Before examining the baby, remove the diaper or open the diaper completely and examine from head to toe. Now put your hands and start examining the head, anterior fontanelle, posterior fontanelle, any swelling, and then after that you check the Moro reflex. Then come to the abdomen, check gentle abdomen, palpate very gently, check the umbilical cord. Then you pull the limbs gently and start examining both hips one after another. After examining the hips, just palpate the both femoral pulses, and after palpating femoral pulses, check the genitalia. If he's a boy, check the testicles, about the whether the testicles are in the scrotum, check anus, and then you check any deformity of the foot. Then finally you examine the back, any midline defect, any swelling, and check the tone of the baby, and then put the baby back to sleep, dress up the baby, and send to the mother. Okay, thank you very much. Dear parents, good evening. Dr.S.M.Zafeer with you. Here is the part 3 for the new parents. Please do not forget to comment, share, and subscribe my YouTube channel. Your newborn immune system does not mature until he is about 2 to 3 months old. In those first few months, the immune system, especially cell-mediated immunity, becomes more developed. This is very important in helping your child fight off viruses. Your baby's health can improve when he sleeps close to parents. In fact, babies that sleep with parents have more regular heartbeats and breathing. They can sleep more soundly, but avoid bed sharing. If you want to go to the bathroom and there is no one to take care of your baby, what you will do? In this case, put your baby in a baby seat and bring the seat into the bathroom. Place it where it will not be splashed with hot water. Be sure you can still see your baby through the shower door or around the curtain. Remove any dangling plants or cords that may be within your baby's reach. Sometimes you are very concerned that your baby didn't poop for 2 to 3 days. Almost all newborns pass their black stool, that is meconium, within 24 hours. It is normal for a 2-week-old baby not to poop every day or every 2 to 3 days. So if he is passing after every 2 to 3 days or 4 days and normal consistency, so don't worry. Constipation is rare in breastfed babies. In the first few weeks of life, breastfed babies can easily go 2 weeks without a poopy diaper. Breast milk is exactly what your baby needs, and so there is little waste product left for the baby to poop out. At times, mothers are afraid to see the pink spot in front of her newborn's diaper. You can just look at this video. Don't get afraid thinking it is blood in the urine. There is a pinkish discoloration on the diaper secondary to urate crystals in the urine. This is a benign condition, and if you want to know more, please watch my uploaded video on pink diaper. At occasions, you may notice your newborn girl have bloody vaginal discharge. Neonatal vaginal bleeding occurs in approximately 5% of newborns and is generally considered normal. It's common for newborn baby girls to have bloody vaginal discharge in the first few weeks after birth. This is your baby's response to her mother's hormones, which are still in her body. But if this discharge doesn't go away in a few days or weeks, you should consult your doctor. There are 3 types of babies cry. Number 1, hunger cry. Newborns during their first 3 months of life need to be fed every couple of hours. Number 2, colic. During the first month after birth, about 1 in 5 newborns may cry because of colic pain. Number 3, sleep cry. Make a good sleep environment and let your baby sleep comfortably. Now regarding feeding schedule, most of the mothers are concerned about how frequent the baby should be fed. For breastfed babies, feed if more than 1.5 hours since the last feeding. For formula-fed babies, feed if more than 2 hours since the last feeding. Be careful not to feed your baby every time she cries. After a couple of weeks, your baby will enjoy 3-hourly feeding. Don't be afraid if your baby is having hiccups. Change feeding positions. Try feeding your little one in a more upright position. Burp more frequently. Burping usually helps with hiccups. Pacifiers can sometimes stop hiccups. Fortunately, babies do not seem to be bothered by hiccups, and they often can feed and sleep even while hiccuping. Now regarding newborn smiling. Often newborns will smile in their sleep. Sometimes a smile in the early weeks of life is simply a sign that your baby is passing gas. But starting between 6 and 8 weeks of life, babies develop a social smile. That is a very important milestone. An intentional gesture of warmth means just for you. That means she is smiling, just for you. Foods that promote breast milk production. Oats, barley and barley malt, apricots, garlic, red beets, sesame seeds, poppy seeds, caraway seeds, coriander seeds, fennel seeds, green leafy vegetables, whole grains, milk, coconut water and coconut milk. These are the foods which can improve your lactation. Now there are some fruits which has got a very good benefit for breastfeeding mothers. Green papaya, avocado, strawberries, bananas, sapodilla, chico, blueberries, rock melon, mango. Do you know that you produce liquid gold for a few days after delivery, that is colostrum? Colostrum meets all the nutrition needs of your newborn. It has strong antiviral properties. It strengthens the newborn's immune system. It acts as a laxative to remove meconium from the digestive tract. It is thicker and richer in minerals and protein than mature milk. Colostrum is particularly rich in vitamins E and A. So if you are producing or if you are secreting even a 1 teaspoon or 2 teaspoon colostrum in the first few days, 1 to 3 days, please just feed your baby this colostrum. Now, at one time, a breastfeed mother, sometimes she wants to store her milk for the next feeding or so. So remember, this is the breast milk storage guidelines for home. Remember rule of 4s. 4 hours at room temperature and 4 days in the refrigerator. You can safely keep this express breast milk. Never microwave breast milk. Now, how you will check the temperature of your newborns? There are 3 main places to take a baby's temperature. In the rectum, for best results in babies and toddlers up to 3 years of age. In the armpit or in the ear. You can watch my YouTube video on normal body temperature. Now, what age babies say mama? You are always eager to see that when your baby starts saying mama or dada. It can happen as early as 10 months. She may say mama as early as 8 months, but she won't be actually referring to her mother. By 12 months, most babies will use mama and dada correctly. Now, it's very important. New parents are often severely sleep deprived. Lack of sleep in new mother. Sleep loss can lead to mood changes, and new moms are at risk for the more serious postpartum depression. If you are experiencing some of these symptoms, talk to your doctor to address them. Mood changes may be made worse by sleep deprivation. Talk about your sleep needs. Do it early. Before you bring baby home, once you become pregnant, discuss your ability to handle sleep deprivation with your husband. Do not take on any extra responsibilities when you have a newborn at home. Sleep when your baby sleeps. The key to staving off postpartum sleep deprivation is to sleep when your baby sleeps. If your baby takes a nap, put everything aside and take a nap too. Everything can wait except the baby. Accept any help that you can get, because sleep is very important for the new mother. Many people are resistant, but whether it is a family member, friend or babysitter, accept help so you can get a few hours of sleep. Some people think that sleep as a luxury, but it is a medical requirement. A cool, dark environment is also optimal for napping. Switch off your mobile phone. Let's divide the task. If your baby takes a bottle, ask your husband or someone to take on some of the feedings. If you are breastfeeding, consider pumping and giving someone else a turn to feed. Try to divide up all your household responsibilities as best as you can. This is the end of the third part. If you like this video, please subscribe, like and share. Thank you. Stay blessed.